Move on to the next speaker. It is Kim Datek, who works with the Vermont Child Health Improvement Program, BCHIP, and PQC on perinatal community outreach projects. As a nurse practitioner since 2014, she has worked across diverse clinical settings. Her work is dedicated to improving health outcomes for birthing parents, infants, and families through the integration of evidence-based practices, community engagement, and interdisciplinary collaboration. And we are super happy to hear about the BLISS program.
Awesome. Thank you so much, Molly. Can everybody hear me okay? Excellent. So yeah, today I'm going to introduce BLISS briefly. So BLISS is the Bidirectional Learning for Improved Support and Services Initiative. And this is a body of work that is focused on supporting our community partners who care for or engage with birthing people and or people who use substances. Next slide, please. Disclosures. Next slide. And for today, I have identified two learning objectives. First, that learners be able to describe the goals of the BLISS initiative, and also that learners be able to identify two community-based partners who are involved in supporting perinatal individuals who use substances. Next slide, please. All right, so I will not reiterate all of the information from the maternal mortality review panel. You heard about that from Elisa and Katie and Kayla, but I do just want to quickly highlight that BLISS was created in response to the 2024 MMRP recommendation to enhance and coordinate substance use disorder supports across clinical and community settings. So on the clinical side of things, you just heard from Kayla about all the wonderful things they are doing with implementation of the Care for Pregnant and Postpartum People with Substance Use Disorder Safety Bundle. So BLISS parallels those efforts, but with our non-clinical folks across the state. Next slide, please. So the goals of the BLISS initiative are pretty straightforward. First, the first goal is to increase understanding of perinatal substance use among community partners and ensure that it remains forefront of their thoughts. So this is a real opportunity for change in a person's life, and we want to be sure everyone who might encounter a pregnant person or a new parent in their work has the foundational knowledge to approach substance use and the associated challenges with confidence. Second, we want to decrease the stigma and bias that surrounds perinatal substance use, helping caregivers to foster trust, increase engagement with services, and reduce fear of judgment or punitive consequences. Third is to improve integration between community-based perinatal and substance use recovery supports. So Vermont, we know we already have a lot of great resources and people who are committed to this work. It's just a matter of making sure that they're all talking to each other and connecting their clients to those wraparound services. And lastly, to provide more equitable care for perinatal individuals who use substances, ensuring that each individual is connected with the services and supports to achieve their personal goals. Next slide, please. In terms of how we're structuring BLISS, so we've established there are gaps in how we care for birthing people who use substances. As Elisa shared at the beginning, we saw in that MMRP data that the majority of deaths are happening in that postpartum period, often beyond when the birthing person is followed by the obstetrics team. BLISS addresses those 2024 MMRP recommendations with two components. So first, by fostering communities of learning. So essentially, we are hoping that local or regional groups or organizations who are interested in engaging about this topic will come together to build connections and relationships in order to create sustainable community collaborations that drive long-term improvement in substance use, support, and care. And then also by providing learning modules. So these are educational sessions, materials that are intended to serve as the framework for discussion for those communities of learning. These will provide foundational knowledge, evidence-based practices, practical skills, and we'll also share resources. And again, BLISS is really bi-directional in nature, so we acknowledge that each individual or organization has a unique perspective and service to offer, and we want everyone to engage in those conversations. The modules are really intended to be sort of a jumping off point to get folks to think critically about their role and how they can provide support. Next slide, please. So of importance is that BLISS is centered around engaging partners and people who have lived personal or professional experience. So our materials and content have all been driven by the feedback and recommendations from these partners. So whenever we're presenting data, research findings, et cetera, we've really looked for connections to what the lived experience tells us to be sure that it feels relevant, that it feels tangible, and that it can truly inform empathetic care approaches. This, of course, brings authenticity and insight into the conversation and highlights real world challenges and successes and brings the data to life. Next slide. Okay, there we are. So going back to that MMRP data on timing of maternal deaths, we can clearly see that the postpartum period presents an opportunity, but of course it's also a really perilous time. So during that pregnancy, focus is all about mom. And then after the birth, that focus really abruptly shifts to the baby. That new parent is now managing a lot. So in addition to the unique challenges of substance use, there's like the usual stuff that just goes with early parenthood, the exhaustion, the loneliness, the isolation, the overwhelm, hormonal changes, et cetera. So the need for support during this time is really greater than ever. So follow-up with obstetrical care tends to end. So there's fewer touch points focused on the birthing parent. And then during this time, what we see is that engagement with substance use supports and MAT decrease and return to use increases. So folks really need that community, connection, and resources in order to successfully navigate this time. BLISS is really all about making those connections and working with existing organizations and resources to ensure that birthing people are adequately supported. Next slide. All right, so big list here. We've identified many potential partners throughout the state who we would like to engage with for this work. These are all folks who either care for birthing people or people who use substances in a variety of different capacities. So keeping in mind that bidirectional lens, these might be folks who are interested in sharing their experience, their expertise, or their observations, or who might need more information about that substance use in pregnancy and the postpartum period. This is certainly not an all-encompassing list, but gives an idea of where we'd like to start. Regions have varying organizations and services available. We talked about that a little bit earlier. So those communities of learning will certainly look different throughout the state. Of note is that, in considering this list, none of these organizations or groups is something that's specifically focused on addressing perinatal substance use, but all are likely to encounter a pregnant or postpartum person who uses substances at some point, which is why it's key to be sure they all at least have some foundational knowledge and know how to provide support. I think in Vermont, truly wraparound care is possible. We have a lot of resources. Again, we just need to knit them together in a really sustainable way. Next slide. Right. So putting all the pieces of this perinatal substance use puzzle together, what we know is that, like we said, Vermont has a lot of great resources and people invested in this work already. They all have unique areas of expertise and valuable tools or knowledge to share. We do not need to reinvent the wheel. Like we don't need new and different things necessarily. We just need to broaden the focus, be sure that we're discussing all substances, equip all professionals who interact with pregnant or postpartum individuals affected by substance use with essential knowledge, resources, and connections. So needed to deliver comprehensive person-centered care that supports their unique goals and well-being. Next slide. All right, so just to make sure everybody's awake and involved here, we're going to pause and do a really quick audience poll here. I'll give Angela the prompt here in a second. But again, this is anonymous. This is not a quiz. This is not a right or wrong answer. We're just curious what folks are thinking and getting people engaged here. So Angela, are you able to start the poll? Yay, it worked. It's always exciting. All right, so the question here is, what do you believe is the most significant barrier to engagement for perinatal individuals who use substances? So our options are stigma and fear of judgment, concern for legal repercussions or consequences, fear of losing custody of their child or children, lack of access to care, inconsistent or insufficient screening and referral practices, or other, and there should be a write-in box there. So I will give people a few seconds to reflect on that and answer. Angela, whenever you see a significant number of answers start coming in, you are welcome to advance to the next slide and also start to share those results. Awesome. Thank you. All right, so it looks like things are still coming in here, but yeah. So again, there's no right or wrong answers here. This is just, people's thoughts. I do see that most people chose this fear of losing custody piece, and then that stigma and fear of judgment came in a close second. And I think that's really important. They're all really, really important factors. Every situation is very unique. I will say that in recent discussions with our advisors who have lived experience, that fear piece, fear of losing custody, fear of DCF involvement, has come up frequently. So addressing this is a particular area of focus for this initiative. And we hope that our community partners help us address all of these issues. All right, next slide, please. So bringing in that lived experience perspective on fear, we're going to play a couple of quick audio clips from patient family advisors. The first is from Ariel. I don't know that she's still on the call, but she is a peer recovery coach and the director of the Kingdom Recovery Center. And you also heard from her earlier with the IDTA team. Angela, are you able to play the first clip for us?
There's a lot of fear around potential losing child. The fear of having your child taken into custody and not being in control of when you can see your child or how you can parent your child is a very real and valid fear. And I think that it causes people to shame. It makes them want to lie, hide, and not reach out because they're afraid if you reach out, what might happen.
Awesome. And then we'll also hear from Ashley. I know there's been a lot in the chat about Ashley, another one of our patient family advisors. We also heard about her in Natasha's presentation, and her clip is really short and sweet and sums it up nicely. If you can play that one, Angela.
The stigma and shame is very real, and it's what hurts people. That's the thing that stops people from wanting to ask for help.
Yeah. So short and sweet and to the point. So thank you again to Ariel and Ashley. Yeah, if you guys happen to be here or in the chat, I guess Julie said she's not at this point. But anyway, we thank them so much for that and giving us those clips. Next slide, please. All right, so at this time, there are 6 BLISS learning modules planned. Some are completed, some are in process. These are free. They are available to any group or organization around the state who's involved in or interested in this work. I won't go into the topics too much, but they're here. One reviews the Vermont data and background information. Another that looks at the science of addiction and explores the perinatal time as an opportunity for change. Of course, addressing the fear in perinatal SUD. Another looking at perinatal mental health. One that looks at stigma bias and lessons from the Respectful Maternity Care Toolkit. Probably planning to work pretty closely with Kayla on that one to make sure that ours very well align. And then another that's taking care of the caregiver, really looking at secondary trauma and self-care strategies. This is a difficult field to work in. We want to make sure that everybody's got the support and resources they need. So to create these modules, we're compiling a lot of existing data and resources into the presentations. The presentations have a focus on non-clinical topics and are modified for an audience who may not have a significant medical background. And last slide. All right, so to wrap things up here, I am always interested in engaging with folks who are interested in this topic. As I mentioned, the educational content is free. It's available to anyone. For now, I'm available to present either in person or via Zoom to any interested groups. In the future, we will establish an online home where these materials can be accessed and used on demand. There is a QR code and link here that can be actually used to go ahead and schedule a BLISS learning session. My contact details here are also included, and please feel free to reach out with any questions or comments. And it looks like we'll wrap up exactly on time. Thank you so much.
Thank you so much, Kim. And to all of the presenters in this last hour for some really impactful work that's going on.